Thank you, Mr. Chairman. I appreciate everybody, appreciate what all of you had to say. I agree with what each of you talked about. It is so important that we have quality, affordable, accessible childcare. I've worked on this issue for many years, and I remember as a parent, first time I dropped every one of my little ones off at childcare so I could go to work. You just wonder, like, is this going to be good? Is this my child going to flourish here? And sometimes, you know, the quality of some of these places are not very good, and it is hard to afford. It is as expensive as college, particularly if you have 2, 3 children in childcare. When you send your children off to school for the first time after they're out of childcare, it's like you got a pay raise. It's how expensive it is. And that's why I'm glad that we did in the Working Families Tax Cut Plan a $2,200 per child tax credit. We did more to help employers provide health care, child care. And I know that at the state level, I'm looking into this fraud issue because we have a responsibility to do that. If you're stealing money away from child care, you're depriving people of access to those resources and undermining confidence in that system. In Ohio, we put in place a strong licensing program, as Mr. Wilde talked about. We have a star rating system so that people know what kind of quality that they have. We have a payment system based on attendance, not enrollment, where you have a PIN number or a photo ID or a QR code that you register your child at that child care facility. And I'm sure we can get better. But I know this, HHS says we have a 0.77 improper payment rate in Ohio, and the national rate's 4.93%. In Minnesota, they paid on enrollment, not on attendance. I don't believe that they did all of these things that Mr. Wilde talked about. And if you look at those numbers, if you take the national number, 4.933 versus 0.77, that's, and you assume that we have $30 billion a year that we use for subsidized child care at the federal level, that's $1.48 billion of improper payments. At that rate, it would be much, much less if we were lower the rate to the same rate that Ohio had. It would actually provide, just eliminating that fraud, access for 1.5 million more children to receive subsidized child care in this country based on the current appropriation that we have. And so, how do we do all that, right? That's our challenge. And I would like you, Mr. Wilde, if you would, to just talk a little bit more in depth about this licensing process and how, and the accountability processes that you have, from your experience, that we can do to make sure we achieve all those goals: quality, affordable, accessible child care, but eliminate the fraud.
Thank you, Senator Husted, and I appreciate your reflections on your own experience getting child care, and congratulations to the state of Ohio. I think that one thing I just start is to differentiate a little bit between improper payments and fraud. Fraud is a subset of improper payments, but a lot of improper payments are actually mistakes. And for child care providers who are at the same time the substitute teacher and the backup cook and the clerk and the CEO and the CFO and the director of human resources, mistakes happen. And so I just set aside in terms of improper payments. What we found in Wisconsin was more like organized crime, in that there were children who literally weren't there. And so I think at the time, I can't remember exactly, but that we had a good improper payment rate because the fraud that we didn't see wasn't something that would have been captured in improper payment.
Yeah, there's both.
Yes, exactly. And from what we experienced, the kind of fraud that we saw is, if you think about, just to use easy numbers, a voucher is worth $10,000 a year, and you have a provider who has 20 children who are not actually there or not actually attending, you realize how quickly that number gets higher and higher. And when there's 5 providers or 8 providers, how quickly that rises. Again, I would differentiate that between mistakes and fraud. What we did in Wisconsin was that we recognized we had people who were going to centers all the time. They were doing unannounced visits. They were showing up there to look at child health and safety. And when they were there, they would look to see, are the outlets covered or are there sharp edges on the playground? What they wouldn't do is
Yes.
to have a list of the subsidized kids who were there. And so providers understood that this was not what they were looking for. And as a result, the people who were the eyes and ears weren't actually looking to see how taxpayer dollars were spent. So the first thing we did was to connect those dots, to say, when you go out to do a site visit, also know how many kids have childcare subsidies in this building. And if you see some huge disparity, make sure that you're flagging that. The second thing is, and I think it's really important in fighting fraud, not to create enormous new bureaucracy that providers who are small businesses have
And
to
you
deal with.
and once you establish this, there's analytics that you can be able to use to know, like, to check for signs and then send the inspectors out when you see that.
That's exactly it, is that I think fraud detection and pursuing fraud should be very focused and use data. So I mentioned the on-site data you would get from a licensor. I think in the context of using data that a state data systems already capture, we found examples like we had our child care regulation and our child care subsidy.
The chairman would like you to suspend your great answer.
Apologies.
Thank you, Mr. Chairman.
Apologize.